Hey guys, Tanya again. Just got off work about an hour and a half ago. Sunday here, which means it's 3 days post-op. 3 days since I've gotten my surgery and my dentures. Little update. I woke up this morning in pain. The pain has finally set in after 3 days. I don't know what to think of that. I figured the pain would be, immediately after the numbing wore off the first day, but I think that since I'm using things more and I'm talking more and I'm kind of eating soft things, not even like French fries. I'm even staying away from French fries, but soups and mashed potatoes, and I had the eggs and a little piece of sausage the other day, and the meatball, which I didn't think affected me. Maybe it did because I had one little meatball cut up in little tiny pieces, and it was fine that night. Then I went to bed and I woke up this morning to go to work, and my everything, just the whole thing, and not so much the bottom because I kept the partial denture out most of the day yesterday and all night last night. I haven't put it in yet, back in. I'm going to wait till my dentist sees it and sees if he can make some adjustments before I put it back in. But I woke up and it was just not in pain, not sharp pain, but just sore. And I just had that nasty, dull, sore feeling. But I did everything I was supposed to do. I did the rinse, took my antibiotics. I did take an ibuprofen just because I was on my way to work, and it was Sunday brunch. And I do a lot of talking. I always kind of do at work. We're big on customer service. I'm one of the managers, so I speak to the staff and communicate with our patrons, and we have a lot of VIPs who I know fairly well. So, just talking to them, and they want to see how I was doing, how I was feeling. So, which was really, super nice. We've got great customers at the O Club, at the Butler Officers Club here on Camp Butler, Okinawa, Japan, for the Marine Corps. But so I knew it was me talking, and I didn't want to look like I was in pain, so I took an ibuprofen, which helped. Within 30, 40 minutes, I was fine. I had no pain, no nothing. Still got major swelling. This bruise has gotten bigger and darker, and I wish I had time to put an ice pack on it or something, but I don't have time to do that. I barely have enough time to make these small little videos before I'm off to the next thing. But I got like a 3-hour break. It's supposed to be 4 hours, but I had to do something else at work that took some time. So, and then we went and ate lunch, and I had a grilled cheese sandwich off the kiddie menu. It came with fries. I gave my daughter my fries. But I had a grilled cheese sandwich. I didn't eat the crust because the crust was just a little too. It wasn't hard, but it was just too much. With the pain I went through this morning, I didn't want to, irritate it anymore. So I pulled the crust off and just ate the grilled cheese. Really easy, kind of pulling it off instead of with my teeth instead of biting it off. I think it took me like 30 minutes to eat a kid-sized grilled cheese sandwich, but it was good. I got something in my stomach. Had some tea with it. Of course, still no straw. I'm feeling okay. I've got the next 2 days off. I'm working again tonight from 6 to 11, which is, I'm kind of like working a double. I'm working from 9 in the morning till 11 o'clock at night with only a 3-hour break in between, which is, not crazy because I've done it several times before. It's just that not when I've got all this, going on. But I have tomorrow and Tuesday off, Monday and Tuesday. I have to go to the dentist in the morning. Can't remember what time. It's on my phone here. And he'll tell me what's going on with my mouth. Hopefully he'll still be happy about the results, and I'll be happy too. What else? Again, I didn't wear the lower partial today, but I'm speaking. I mean, the S's are still TH. THs are fine without the partial lower. The S's, I still have a lisp, but again, it's only been 3 days. I can work on it. But I'm speaking a lot better without the lower partial. I feared I'd have more issues dealing with the upper denture than the lower partial, but that's just not the case. Again, I'm hoping he can do something, trim it down, make an adjustment to where it's more comfortable. I don't have so much of a healing, well, an adjustment period with that, to where it's not rubbing. Because if I have to deal with the rubbing like I remember I had to do with braces, it takes a few weeks to a month or two to your mouth, at least my mouth, to get used to all that stuff in there. That's where the sensitive areas are, like, your inside your chin, your cheek, and then your tongue, and yeah, it can really jack stuff up. But if it can't, I'll get used to it. I'll just have to get some medicine to numb stuff up. Go buy a nice bottle of scotch and a peaty scotch and rub it on there. Whatever. A funny thing happened today at work. One of our VIP patrons, he said, I'm not gonna say his name because you may know him, but he's a two-star general, really super nice guy. Him and his wife and his daughter, they're just sweet people. Of course, he knows the ordeal about me. I don't know if he knows I got my teeth extracted. He just knows I had some oral work done and a surgery done. Well, it's not a major surgery, but it was in the hospital. So he knows that. I don't know if he knows that I have a full denture or anything. But he pulled me to the side as we were leaving, and had this, stern, really, not stern, but serious look on his face. Put his arm on my shoulder, standing beside me. And the way he was talking, I was like, oh, I'm thinking to myself, oh God, what have I done or my staff done? I mean, did we not, something's wrong. And again, he's a two-star general. This is his club. So, and I've never heard him address me in such a tone before. He's usually very sweet and uplifting, and So he pulls me to the side and puts his arm around, and he says, okay, so who do I need to have arrested, or who's asked do I need to put my boot up? I said, sir? And he said, this. I'm talking about this. And still, he's serious. He says, this. I'm talking about this. And you're swelling. What's going on? Who is it? And he said, do I need to go get your husband? I said, oh, sir, no. No. I had some major surgery the other day, and I'm swollen and bruised. And he started laughing. He said, Tanya, I know. I'm just messing with you. I said, but I knew, I'm here for you if you ever need me. He said, but I just want to see how you were doing, how you were recovering, and how things are progressing. I said, sir, I'm fine. The bruising, it's normal. The swelling, it's normal. It'll go down in a few days. I'll look normal again in a while. He says, well, I'm just checking on it because I know you had something done, and I'll make sure you're okay. And he said, but I'm serious. If you need somebody, if you need me to get somebody for you. I said, sir, I know. I know you're there for me, and I do appreciate you looking out for me. I said, but I'm fine. I said, I appreciate you you asking about my health and welfare, but no, I'm good. And I said, but thank you, and tell your wife I said thank you too. But that was kind of funny because it kind of scared me just for a second, because my relationship with him is different from a Marine's relationship with him, because I'm not a Marine, I'm just a spouse, and I provide a service for him, but I'm not under him, But I think he's a super sweet guy. Again, I'm not one of his Marines, So they may think something else of him. I don't see how. He just seems like a really decent guy. Anyways, enough about him. Smiling a lot more today. I did. I wasn't afraid. In fact, I wasn't self-conscious hardly at all, which was good. I didn't even think about it a bit. The only time I did think about it was when people came in and they say, oh yeah, you're back at work, and then I'm like, oh yeah, that's right, I had something done, and they say, oh, smile, and I smile and say, oh, they look gorgeous, and oh, you got better teeth than me, and I wish I had your teeth. I said, no, well, that may be true, but you don't want to have to go through what I went through to get these teeth. But had a lot of compliments today. Just the customers I haven't seen, customers / associates, friends, because they're not just customers to me, they're kind of like family. Everybody becomes kind of family in the Marine Corps, especially when you're on a small island together and you're always running into them. But it's super sweet. Everybody said they look really good, and So I'm happy about that. But that's the only time I even thought about, my dentures whenever people would mention it. And it's not that they were mentioning my denture, because some know I've had denture put in, and some just know that I was going under some oral surgery and having my teeth worked on. Not, I didn't tell everybody that I was having them taken out. I just said, having oral surgery in the hospital. I'm having some dental work done. So, like I said, some knew, some didn't, But regardless, all of them said that they looked great, So that's good. I'm happy about that. What else? Just that pain this morning. It after 3 days, it finally kicked in, and ibuprofen helped. The 800 milligram. I love that stuff. I think if I broke my leg, I'd rather them give me ibuprofen than any kind of narcotics, just because I don't like the way narcotics make me feel. And they have the opposite effect on me. They don't make me tired or sleepy or, woozy or goofy or whatever. They make me hyper, and which is not good if if your prescription from your doctor is including staying in bed and resting and trying to heal when I'm up going bananas cleaning the house or, doing something crazy because I've got way too much energy in my system because of the medication. And also I've got anxiety disorder. I just kind of threw that out there, but I have anxiety disorder, which means every once in a while my body will just produce and release this massive load of adrenaline, and I get this fight or flight thing going on. And of course, there's no real danger. My body doesn't know that, and my mind is thinking, "Oh God, there's something wrong. We gotta either fight, or we gotta run like hell to get out of here." Of course, I know there's nothing going on, but just if you've ever had a panic attack or anxiety attack, you know exactly what I'm talking about. Anytime I take a medicine or do anything that makes my blood pressure shoot up real quick, or gives me a boost of adrenaline when I don't need that adrenaline for anything, like exercising or a danger or an alert or something, then I have an anxiety attack, and they are not pretty. They're not nice. So I stay away from most medicines. I don't do drugs. I don't take pharmaceuticals for fun. I don't take them when I'm supposed to, prescribed. I stick with my 800 milligram ibuprofen and for anything. And I don't get headaches. I mean, I really, especially the only time I take an ibuprofen is if I get like a really nasty, bad case of menstrual cramps. And that only happens maybe once or twice a year. And, for the cramps part. And, what else? Or if I have a surgery, and I have to because of pain. That's it. Anything else? Anything else? I hope everybody's having a good time, a good weekend day, whenever you're watching this video. I was going to talk about my thoughts and feelings about my family's thoughts and feelings. That's what I was going to do today. So, my husband, I had mentioned to him about a year ago that I was thinking about getting dentures. At first, I was going to get the upper and lower, just to take them all out, replace them all. And then I talked to my dentist, and he suggested that I do the lower denture because they're harder to maintain. They get loose, and they're just harder to deal with. He didn't want me to do that at such a young age, at 40. So he was looking out for me. So I got the partial lower, because the ones here that are mine, I mean, they're strong teeth. I need to bleach. I haven't bleached my teeth in, God, a year. I need to do it soon to make it look like my other teeth. But he advised against it, and I trusted his judgment, and so far so good, except for the fact my partial lowers, rubbed me raw, but that can be fixed. So anyways, my husband, he knew I had been self-conscious for years about my smile, and it was bringing down my self-esteem a lot, which it was causing problems, in our marriage, not for, like, a pending divorce or anything, but it was just, I wasn't happy, with the way I looked. He would tell me I was beautiful, and I'd be like, whatever, or he'd give me compliments, and I would kind of reject the compliments or not respond to them, or, you know, I wouldn't put myself down, and he would never put me down, but I didn't reciprocate on his nice comments towards me, and that's not really good for a marriage or any kind of intimate relationship or relationships at all. So it didn't hurt, but it didn't help our marriage either. So when I had told him I'd made the decision, I was going to get it done, I had an appointment, I talked to the doctor, I'd gotten all this knowledge, I'd worked myself up for it, and this was my decision. I'm getting it done. He said, go for it. Do it. Makes you happy? Do it. His theory is a happy wife, happy life, which is kind of true. And he also says if mama ain't happy, nobody's happy, which is kind of true. I'm not a bad wife or a bad mother. It's just a saying that my husband says, and sometimes it just happens to be true in my house. But anyways, he was full on board. I told him he'd never see me without it out. He'd never see me with my denture out. And he said, hey, whatever makes you happy. If you don't want me, it's not a big deal to him. He doesn't really care. But he's listened to everything I told him about, how it's going to be from here on out, and what I might try to get done in the future, or how my life is going to be, or how my mouth is going to, be now and years down the road, with having this done. And he was like, whatever, even if it costs money, just whatever you need to do. If you're going to get implants later on down the road, or get the implant things to where you're clipping the denture up in there, or you get an implant for every tooth. He said, I don't, whatever makes you happy. And I said, oh, okay, well, I appreciate it. I don't want to spend much money on that. I mean, I'd like to send my daughter through college. My son's already got a free ride, but I'd like to be able to have money for my daughter to go to college. Time comes. But, so he was okay about it. My 8-year-old, she'll be 9 next month. She doesn't care. She don't care. She knew that mommy was having surgery, and she doesn't really know the concept of surgery, well, she kind of does, because she had oral surgery last year. She had to have a filling, excuse me, and the tooth cleaning, and the stuff they cut the kids' teeth with. I can't really think right now. A fluoride thing. But she has sensory issues, so they can't do it in the doctor's office, and they can't put her to sleep in the doctor's office to do it. And she has her diagnosis is developmental delay with autistic characteristics, and she has sensory integration disorder. So certain things bother her, and certain things don't bother her at all. The things that she has a situation, but she's a smart girl, and she's good, and she's she's not handicapped. She has developmental delays, and she's special needs, but she's by all means not handicapped in either way. She's a social butterfly, and she's smart as a whip. She can do things on the computer that I've yet to figure out how to do. So she just knew that Mom was having surgery, and she'd been in the hospital operating room for dental also last year. So I told her that I'm going to the hospital just like you are, and have my mouth worked on just like you did. It's going to be okay. So she's like, oh, okay, no big deal. About how she feels about these, she doesn't care. She just knows that Mommy's got a big, pretty smile now, and that's it. And again, the only thing she cares about is that I love her. She's loved her dad too, and her big brother, and that's all she cares about. So yeah, that's easy. My 19-year-old son, he's got a great smile. He's got a perfectly natural smile, no braces needed. He broke his jaw in 3 places. A few years back, my husband was deployed to Afghanistan. My son had a bicycle wreck, fell over the handlebars, and first thing to hit the pavement was his chin. Got a nasty gash right here and broke it right here, right here, and right here. His maxillary, his mandibular jaw, right, just bad. So he had to have, surgery and his mouth wired shut, and, And then we had what teeth were, had been chipped off or broken off. We had completely repaired. I mean, he's got a beautiful smile, white, straight, just gorgeous teeth. We spent decent money on to get him that way. But he knew that I was really, for years, self-conscious about my smile. It was making me very unhappy. My son doesn't like to see me unhappy. Well, he's my son. He loves me. He doesn't, and I want to see him happy. But he just knew I was really unhappy with my appearance, and this was it. This was the thing that was making me, not like myself. So, he feels the same way about me. Dentures at 40, not a good thing. But at the same time, he's realistic, as am I, and he's a smart kid. So he said, listen, you've done the research, Mom. You know what you're getting into. He says, I hate that you're not going to have your natural teeth, that you're going to be losing your natural teeth and having something else. He said, I hate that that's going to be the case. He said, but if it makes you happy and it's going to be you're going to be able to function, eat, speak, and it's not going to hinder you in any way, and it's just going to better you, then by all means do it. And he was behind me 100%. So, yeah, in fact, the day I had my surgery, and I came home, he had just left for work. So he didn't see me. And then when he came home from work, I was in bed, not asleep, just kind of resting. And he walked in the door from work and came straight to my bedroom and gave me a big hug and wanted to see my smile and told me I looked really good. And he was proud of me for getting it done. And he's been behind me ever since. So, I guess he's fine with it. He says, he's always said that I was, pretty and Mom, you're so pretty, but, he said, Mom, you look really good. Just to let you know, you look nice before, but you look really good. I was like, oh, how sweet. My son tell me his mama's, getting me hot again. So, my mom, she's happy to have this done because she knew that I was very unhappy with it. And she'd had it done, and my younger sister, the middle one, had it done. I'm the oldest of 3 girls. So they had already been through it, been there, done that. So it wasn't a big deal to them. I'm still happy. I'm still happy I had it done. I am. I'm still working on it. The only thing that I'm struggling with, and just a little bit, I mean, I'm talking about like a 0.5% out of 1,000 I'm having any kind of struggle with, is the fact that I'm going to have this thing in my mouth that I'm going to have to maintain and take care of for the rest of my life. If I don't get anything else different, like an implant or something, that's going to be the case. And I'll have problems with it in the future. It may break, they may, stain, they may start getting really, really loose, and, I have to keep on getting the adjustments or the relines all the time, or if I don't have time to get a reline because I'm working, or, I can't get an appointment, and I deal with, loose teeth for a couple days or a couple weeks, that bothers me, and the fact that may be in my future at some point in time. But I'm more happy with the way they make me feel. Aesthetically, they're pleasing. I like them. The speech will come later as I get used to them. So yeah, I think it was still a really good choice for me. I can't speak for anybody else. I can only speak for myself. Again, my husband's happy about it. He wasn't pushing me to get it, but he was just like, whatever you need to have done, and he's always been like that. He's like, you want to, I've had 3 kids. He's like, want to get a tummy tuck? We'll get a tummy tuck. If you want to, again, 3 kids. You want to, do a lift with a nice little, get you back to your 18-year-old, you know, chest. We'll do that too. Just whatever you want to do. We'll, Botox, like whatever. It's not like I need a lot of things. I don't want plastic. I think it look okay now. I'm 40. I got 3 kids. I'm realistic. But he's very behind me being happy. So again, his theory is happy wife, happy life. So I think he's kind of right about that. That's it. Tomorrow I have a dentist appointment. And I'll let you know what they said. And so far so good, except for waking up this morning just feeling like, it wasn't a pain. It wasn't painful, but sore. Very, very sore. I don't know if it was, maybe I'd laid on my face the wrong way and it was putting pressure on some tissue that wasn't used to the, being in contact with a nutrient. And I would maybe pushed against it all night and maybe rubbed, or something. My denture's not loose, but maybe the outside here, it was rubbing against the soft tissue on my cheek. I don't know, but it was sore. It wasn't like my gum, my incision area, or my suture area was sore. It wasn't underneath my denture. It was everything all around was sore. And then my face was, hurting. But, other than that, no big issues. And I took an ibuprofen, did my rinse, took my antibiotics, and that was it. I'm still not taking any hydrocodone or Tylenol 3 or whatever the stuff they gave me was. I can't really remember. But I just kind of put it in my medicine cabinet and haven't touched it. But anyways, so far so good. Business back to usual. I got the next 2 days off, and I am gonna rest because I've had a busy week Wednesday on at work. So I'm gonna take it easy and get the rest that I should have taken this week after my surgery, but didn't take it. So I'm actually gonna rest and see how that works. But anyways, ciao. I hope everybody's having a great day, great evening, great night, whatever. And again, like, subscribe, comment, questions, concerns, tips, tricks, whatever. I'll respond to them as soon as I can. I'm pretty good at responding to Facebook things, so I've never done a YouTube site or channel or anything like that. So this is new to me too, but I'll respond as soon as I can, like hopefully within 24, 48 hours of you putting something in there. Again, I'm not going to respond to negative comments. And if you have put a negative comment on there, I'm just going to delete it. But negative comments, I'm not going to respond to. And you know what I mean? I mean, just, if you're commenting about the fact that I sound, like I got a bad lisp or, whatever. Whatever the case may be. If you're just being, a butt and you're being a troll, don't troll me. Is that even a term? Don't be a troll. Just don't be mean. I'm not gonna respond to those. In fact, I'll probably delete them. And honestly, I don't care about those opinions. Again, I'm 40 years old. I'm halfway there. And unless you're paying your bills or watching my kids, I could care less about your opinions about me. But that's one of the good things that comes with getting older. You don't worry about the small stuff. Anyways, have a good one, and I will talk to you later. Ciao. Semper Fi.